So good afternoon. Today we have a few updates on testing, on personal protective equipment, and hospitalizations related to COVID-19. We also want to share an announcement on our shared work with community health centers to increase testing and tracing in communities across the Commonwealth. First, I want to provide a quick update on PPE. As of yesterday, we've delivered over 5.3 million pieces of PPE, and that includes masks, gloves, gowns, and other items the Command Center has provided to hospitals, nursing homes, other facilities on the front lines, and first responders and emergency management personnel. Our Command Center is in communication daily with hospitals and medical professionals around the Commonwealth to monitor the capacity in our hospitals. As of yesterday, there were 3,872 patients hospitalized statewide for COVID-19. That includes a little over 80 new hospitalizations for COVID-19. 9% of all the COVID-19 positive tests we've done are currently hospitalized. Out of the 18,000 available hospital beds statewide, ranging from ICU beds to field hospital beds, 56% of those beds are unoccupied and available for patients. The Commonwealth's healthcare system is an incredible collection of people and organizations. In just a few weeks, it's mobilized to dramatically increase capacity, including 5 new field hospitals. We'll continue to monitor the rate of hospitalizations to ensure there's enough staff and space to respond to the surge. But as a reminder, if you have symptoms, if you feel sick, if you have a chronic medical condition, please reach out and contact your healthcare provider. And as I said yesterday, you can always use Bowie Health's online symptom checker to connect with telemedicine options and others if deemed appropriate and necessary. That's available at bowie.com/mass or at mass.gov/COVID-19. So far, Bowie's connected with 83,000 individuals here in the Commonwealth of Mass and has recommended direct connections to a clinician in many cases to engage in a telehealth visit, and in some cases has encouraged people based on their symptoms to call 911. We cannot emphasize how important it is for people to recognize and understand that the healthcare system is fully optional and fully functional, and we did a ton of work to make it possible for people who have ongoing medical conditions to be able to get the services and the treatments that they need, while at the same time be able to deal with the surge and all the issues associated with managing COVID-19. I want to give a quick update here on testing. Yesterday, the Commonwealth conducted nearly 6,000 new tests, which brings our total tests statewide to about 175,000. The state reported 1,556 new cases of COVID-19 for a total of just over 41,000 positive cases. The last few days we've seen fewer or about the same number of positive cases day to day, but we think it's too soon to draw a conclusion from that data. First, a few days does not represent a trend. We've seen this data bounce around before. And secondly, the number of positive tests is entirely dependent on who you test. And what I mean by that is daily positive test totals don't necessarily represent what's happening across the entire Commonwealth. Today's announcement on increased testing should help expand the universe of testing, and in many ways will be one more element of how we think about hotspots and opportunities to engage and to intervene. The piece of data we watch most closely is the number of hospitalizations for COVID-19. And we're still seeing an increase, a modest one, but an increase there statewide. Since the end of February, we've increased testing capacity dramatically through the State Public Health Lab and a wide range of lab partners at academic medical centers, commercial labs, the Broad Institute, and others. We now have more than 30 partners that are testing each day. Massachusetts remains a national leader in per capita testing, and we're continuing and committed to building on this work. Part of our statewide monitoring focuses on hotspots or high-density areas where the virus can spread quickly. And we've worked with local partners to address testing needs in several of these high-density areas. In Chelsea, Massachusetts General Hospital worked to quadruple testing capacity and to provide testing and housing developments. The Commonwealth, through the National Guard, also did mobile testing in Chelsea as well. In Lowell, we worked with CVS and the federal government to stand up a rapid testing pilot with the ability to test up to 1,000 individuals a day. The National Guard and Fallon EMS continue to test patients and staff at state hospitals, long-term care facilities, assisted living facilities, and 24/7 congregate care programs here in Massachusetts. And prioritized testing is also available for our first responders, healthcare workers, and grocery store workers in Lowell, in Springfield, and Foxborough. Today we're going to expand those efforts at several more locations across the Commonwealth. In partnership with Quest Diagnostics and the Mass League of Community Health Centers, we will dramatically increase testing at several key community health centers here in the Commonwealth. As everybody knows, community health centers provide comprehensive health services for people across the Commonwealth. And these facilities are also deeply rooted in the fabric of their local communities. They're trusted partners in addressing the broad health needs of underserved populations. And they're committed to eliminating health disparities and facilitating access to health care for those they serve. Working with the Mass League, we've identified community health centers who have the capacity to ramp up testing and needs in areas of high need. This includes many densely populated communities. Quest has agreed to ship 2,200 tests per day to 12 community health centers and is committed to adding more soon. The first group of health centers includes facilities and operations in Quincy, Brockton, Lowell, Fall River, New Bedford, Worcester, Provincetown, and multiple sites in Boston. The Boston locations are Dot House Health, East Boston Community Health Center, Codman Square Health Center, and the Whittier Street Health Center. Harbor Health Services will also have multiple sites coming online. People interested in being tested should contact these health centers this week. Each location is processing appointments differently. Soon you'll hear more about this from Manny Lopes, who's the CEO of East Boston Community Health Center. His community health center has already received 900 tests, and that number will continue to grow. I do want to say, Manny, how much we appreciate the work and the partnership that you and the folks at your organization have provided to us on numerous occasions over the course of the past 5 years. And we're very grateful to have you and your team step up to participate with us jointly in this particular initiative. This increased testing capacity is one crucial part of our response. Another key piece is community tracing. Massachusetts is the first state in the nation to launch a statewide community tracing collaborative to better track positive COVID-19 cases. Here, too, community health centers have an important role to play due to the deep connections with the cities and towns in which they operate. To date, more than 30 community health centers are participating in the Community Tracing Collaborative, working with us to trace contacts in the neighborhoods and the cities and towns that they know so well. By joining us in this program, some centers have even been able to bring back some furloughed staff, which is great news for everyone, as having experienced local staff working on the tracing initiative makes a big difference. And we're always glad to get people back to work, especially during these tough economic times. Over time, tracing is critical to helping us understand the spread of the virus and helping us return to the new normal. Integrating community health centers in our response and ongoing discussions is also an important part of that focus. And as a reminder, we need everybody out there to participate in this tracing program. We've been working with cell phone service providers to make sure that when our tracers make calls, they show up as MA COVID team and are not blocked by caller ID. Please pick up if you get that call. This is your opportunity to help stop the spread of COVID-19, especially perhaps in your house, apartment, or neighborhood. In closing, I know yesterday's news with respect to schools will remain closed throughout the year was yet another sign of how this virus has dramatically reshaped in so many ways our lives and our daily chores, rituals, and all the rest. Schools and businesses are being closed, people are staying home, and people are wearing masks. All a really good thing. But along the way, we're not being able to see loved ones in person, and it's disruptive and disturbing. I think everybody would like to see us find a way to get back into something that looks more like what people used to do day in and day out. But for Massachusetts, which is now a national hotspot for COVID-19 infections, we really do need to stay the course and keep up our efforts to stay home, socially distance, wear a mask, and respect and understand the issues associated with this virus. If we move too quickly, we risk losing the progress that we've made so far. And our healthcare workers in our hospitals, which have been working hard on our behalf, are pushing back against the virus, and they need us to push back too. We owe it to them, and we owe it to our parents and our friends and our neighbors to keep up the fight and to win. We'll get through this, and I believe we will come out stronger on the other side. But everybody needs to do their part and understand that we need the facts on the ground to drive a lot of our decision making. With that, I'll turn it over to Lieutenant Governor.
Thank you, Governor. In this COVID-19 environment and world, we all know it's so important for the people who we serve gain access to the information to be able to keep themselves, their families, healthy and safe, whether it's through briefings like this or others, through your news reports, or through access to the internet to gain information. When we came into office the first time, now more than 5 years ago, not every community has similar access to the internet. In fact, 53 communities underserved or unserved in terms of their ability to access the internet through broadband. And with our efforts in collaboration with others, we've been able to bring access to over 16,000 citizens in these last mile 53 area communities. That is so important in especially these times when we're asking more people to access telehealth or to be able to work from home, or now with students remote learning to be able to access their curriculum and their teachers through those means. But in areas of the Commonwealth, that access through the internet is just not possible, and so there are gaps. And what we're talking about today is a temporary step to fill these gaps. The Massachusetts Broadband Institute at Mass Tech, working with our state-owned network and local internet service providers, will offer new Wi-Fi hotspots to unserved municipalities. These Wi-Fi hotspots will offer on a rolling basis unserved communities to a high-speed connection free of any charge at a public community anchor institution identified by the local ISP. It's critical that citizens who use these hotspots continue to follow social distancing protocols, and the towns and ISPs will post clear signs with the DPH guidance to ensure that people are safe when accessing these spots. Mass Broadband is providing support to local ISPs as needed and is tracking these hotspots as they come online and posting them online at broadband.masstech.org/Wi-Fi. Communities with independently established hotspots are still eligible to receive a hotspot under this program. We want to thank Westfield Gas and Electric as well. They've been a strategic partner of ours to bring broadband access to these under and unserved communities. They will continue to work on these projects, and they're planning 14 of these new Wi-Fi spots to come online to help in these areas. I'd also like to build on the announcements we made yesterday regarding student loans. We talked yesterday about deferring scheduled repayments for no-interest loans for 4 months through the Department of Higher Ed. That will capture about 12,000 students that participate in that program. We also announced additional efforts through the Division of Banks. The Division of Banks has joined a multi-state initiative to secure payment relief options for Massachusetts student loan borrowers. They have also issued a consumer advisory with important information and resources for private student loan borrowers during COVID-19. Several relief options have been secured in Massachusetts with 15 different loan servicers to expand protections for federal student loan borrowers. These new options stand to benefit over 182,000 Massachusetts borrowers with privately held student loans. Borrowers with commercially owned federal family education program loans or privately held student loans who are struggling to make payments due to COVID-19 may be eligible. People can learn more about this initiative by visiting mass.gov/DOB. And finally, again, a message that can't be repeated enough to those individuals feeling vulnerable because of domestic violence, abuse, or sexual assault. If you feel unsafe, call 911 or text 911. If you need access to services, please access the SafeLink toll-free number at 877-785-2020. And for those who are hearing impaired, you can access the SafeLink TTY number, 877-521-2601. I'd now like to turn it over to Manny Lopes.
Thank you, Lieutenant Governor, and thank you, Governor. Governor, I've heard you mention many times that when we're in crisis like this, it's a team sport. On behalf of the Massachusetts Community Health Centers, we are grateful for the support that we've received from Governor Baker, Lieutenant Governor Polito, and Secretary Sutters. For over 50 years, community health centers in Massachusetts have been providing high-quality, easily accessible care to anyone who walks through our doors. We've been working hard to close the healthcare gap for those that are disproportionately impacted by medical and behavioral health issues. We've also been working to address the underlying social determinants of health, such as food access, housing, and education. As trusted resources within our community, we are on the front lines of COVID-19 testing, tracing, and treatment. Health centers provide an additional line of defense to keep patients out of hospitals and help avoid an overburdened healthcare system. In order to protect the community and staff members during the outbreak, health centers have drastically altered operations. We have limited access to routine visits and canceled many elective procedures. This has negatively impacted health center finances. At East Boston Neighborhood Health Center, we serve over 90,000 patients a year. Our primary service area includes East Boston, Winthrop, Everett, Revere, and Chelsea. We serve over 40% of Chelsea residents and over 65% of the East Boston community, two of the most impacted neighborhoods in the Commonwealth. Similar to other areas of the country, we're seeing clear health disparities between different races and ethnicities. Many of our patients are the essential workers. They work in supermarkets, restaurants, and healthcare facilities. They keep our store shelves stocked, help first responders get to work, keep our facilities clean, and care for the sick. Sadly, many of these individuals can't afford the high cost of housing, so they live in crowded apartments with multiple families. In fact, that's exactly how I grew up, right down the street from East Boston Neighborhood Health Center. What was an American dream for me is turning into a nightmare for others as this virus continues to spread in our community. East Boston Neighborhood Health Center's approach to COVID-19 has been extensive, wide-reaching, yet hyper-local. We have been focused on education, testing, and as the governor mentioned, we are part of this unique collaborative with partners in healthcare as well as the state to conduct contact tracing. We are also using data and innovative systems to pinpoint hotspots in our service area. We're identifying barriers to testing and care, and tailoring our services to meet the need. We've engaged our community partners, and we are relying on their relationships in the community as trusted provider to help us disseminate helpful information. At East Boston Neighborhood Health Center, we are now open for testing 7 days a week. Like many health centers in Boston, with the support of Mayor Walsh and the City of Boston, we have modified our operations to offer multiple settings for testing. This includes our 24/7 emergency department, our pediatric, adult, influenza-like clinics, our drive-through testing site, which is in partnership with the City of Boston, our walk-through testing site, which offers a convenient option to our patients who do not drive, and soon we'll launch a mobile testing van with our partner, Cataldo Ambulance. All of this could not happen, though, without adequate testing supplies. So today, I'm excited to hear, with the help of the governor and the entire state, we've established a partnership with Quest Diagnostic that will help us increase our testing capacity to over 500 individuals per day. Thus far, we've tested over 3,000 individuals. And as we all know, testing will be critical for the well-being of our residents and to the overall statewide response to COVID-19. Testing leads to detection, which allows us to keep sick individuals at home in quarantine and reduce exposure to our community members and slow the spread of the outbreak. Having this reliable, consistently supply of test kits will allow us more consistently to test those in need. Thank you again to Governor Baker, Lieutenant Governor Polito, Secretary Sutters. Your support for community health centers will ensure that we have the resources necessary to effect change on the local level and reach those that are most at risk. Finally, I'd also like to thank the essential workers, the first responders, and our healthcare workers who are on the front line right now. And a special thanks to the 1,200 employees at East Boston Neighborhood Health Center. You are my hero. Mary Lou Sutters, Secretary Sutters.
Thank you, Manny. Thank you, Governor, Lieutenant Governor. Truly a shout out to our community health centers across the Commonwealth. It was one of those opportunities we had to match Quest with initially 12 health centers, and we'll continue to expand because, as Manny said, community health centers are such a trusted partner in some of our most vulnerable communities. And just to touch on, as your closer, to touch on something that Manny mentioned briefly, one of the things health centers are so important about is not just health care as we think about it, but also the social determinants of health. And I just want to follow up on a couple of comments I've made before about food security, which we know is not just important right now, but it will be as we work through the economic impacts of the pandemic. To just give you a statistic, in October of 2019, there were more than 500,000 children who received free and reduced price school meals across the Commonwealth. Of those, a little less than half were actually known to our Department of Transitional Assistance and currently receive Department of Transitional Assistance benefits. The Families First Coronavirus Response Act allows states to request a special waiver from the Secretary of USDA to establish what is referred to as a Pandemic Electronic Benefit Transfer Program. The PEBT program, it's an important opportunity to provide nutritional resources to families who have lost access to free or reduced price meals at schools across the country that have closed in response to COVID-19. Massachusetts is one of the first 4 states to receive this waiver from the USDA. It's a cross-secretariat initiative between DTA and DESE. We were actually quite thrilled when we were approved to implement our program. The benefit provides direct financial assistance to purchase healthy foods for families with children who would have received free and reduced price meals if not for school closures due to COVID-19. The payments supplement the more than 1,300 district grab-and-go meal sites. Households directly receive $5.70 per child per school day for the duration of school closures. It amounts to about $28.50 a week per child. It also brings more than $100 million into the Commonwealth's economy, supporting our local grocery stores, our bodegas, our corner stores, and their employees. DESE and local school districts are collecting the necessary data, and DTA is actually issuing the benefits to families. Obviously, existing DTA client households with eligible school children will receive the benefits on their current EBT cards. But it was the families who have not previously been known to DTA that we need to reach out to. So these families will receive a unique PEBT card and notice explaining the program and how to use the card. Households residing in districts that provide universal school meals will be automatically enrolled. This includes some families who are over the income limit for SNAP nutritional national school lunch programs. No family is obligated to use the card, and they're instructed to destroy the card should they not wish to participate in the program. During this public health and economic crisis, families who were previously over income eligibility limits may have lost income sources and need this critical financial support to purchase food and nutritional food for their family. We are working closely with the Shaw Foundation and Project Bread to market and communicate about PEBT. The Shaw Foundation is developing the outreach materials to promote the program to families unfamiliar with DTA and EBT cards. The Shaw Foundation is also creating an external website to house all the information on this program. And Project Bread, a very important partner for us, is assisting with drafting the materials and conducting outreach through schools and all of our food banks and other partners. It's one, but a number of resources we're trying to make available to ensure that families have the resources they need for food security for their families. And on that matter, as you know, we announced that the Command Center would launch a food security task force. Today actually marks their first meeting. It includes membership from state agencies, the legislature, and other partners, including the League, the Greater Boston Food Bank, Project Bread, the Restaurant Foundation, and the Shaw Foundation. The idea is to truly centralize coordination of resources and communication across sectors and across federal, state, and municipal resources to meet the urgent food needs across every part of our state. The plan, they have 30 days to submit a plan so that we can really ensure that families have the food that they need. It'll include a summer season and launch back to school, and obviously thinking beyond the school year. It is to foster communication across all key stakeholders, to pursue traditional solutions, which is we refer to often as the block and tackle, but to be open to experimenting with new ideas and innovation. Using data to drive our decision-making, set priorities, and direct resources. And the goals of the group is to obviously identify immediate needs, to maximize our nutrition program access, and create and implement plans that address all parts of our state, and explore these creative partnerships to maximize resources that are available in the Commonwealth and ones that we can, learn from other states and bring into ours. Like I said, we'll report the recommendations by the end of this month, and we'll continue to keep you updated.
Question?
Governor, can you tell us why Massachusetts is considered a national hotspot, and you think that earlier action here could have changed that?
Well, I think part of the answer is people just follow the data. And while I think everybody would agree, and we've talked about this before, that there's not enough testing that goes on generally, nationally, for a whole bunch of reasons that we've also talked about before. If you're one of the states that tests the most, you're likely to be one of the states that finds the most positive cases. And if you test in places where you're looking to provide strategic advice and guidance to particular communities or particular organizations or particular healthcare providers, you're going to find positive cases too. And I think some of it has to do with the nature of the way we've gone about testing, but I also think part of it has to do with some of the issues that have been raised previously by others who've covered this issue. One is that if you look at most of the states that have the highest number of positive cases or the highest number of hospitalizations, they tend to be states that are dense, relatively speaking, compared to others, or they have particular areas of density. Louisiana, for example, had an enormous outbreak in New Orleans, but most people think that was related specifically to Mardi Gras. If you get outside of New Orleans, the rest of Louisiana is relatively spread out. In Washington State, the big outbreak was in Seattle, which is obviously a city, but the rest of Washington State is also relatively spread out. I think the other big issue is your access to and your connection to the global economy. And if you think about most of the places that have had the most significant outbreaks, they're places that have tons of back and forth, used to have tons of back and forth travel and economic activity between here and many other places around the globe. I think at the end of the day, there will be tons of research that will be done, not just on coronavirus and not just on state responses, but how people ought to think about dealing with a pandemic of this kind going forward. But in the meantime, what we all need to do is what many other states and many other countries have been doing, which is create the separation and the distancing that's required to stop the spread of the virus, create enough healthcare capacity to be sure that you can solve for those individuals who are dealing with COVID-19 and continue to provide the other kinds of services that healthcare systems like ours are so well known for, and then start to think, once you get to the point where you start to see some data that trends in a positive direction, how you actually might safely or more safely choose to reopen some of the things that we've all given up to fight the virus.
Governor, who should be seeking out testing? Still wait for symptoms? Who should be going to the healthcare clinics and ask for a test?
Well, I think the way this is set up is you guys have a fair amount of latitude with regard to that, if you want to speak to that.
We are asking patients to call us before showing up to any of one of our testing sites. Most healthcare providers require you to be symptomatic, and we follow DPH and CDC guidelines around that.
Governor, one thing I would add to that is we have, if you look at the first responder test sites or the test sites for grocery store workers or healthcare workers, I mean, a lot of the test sites, or even the ones that are operating on some of the mobile platforms that we've put together, you know, there's the symptomatic population, but we've also said that if you've been in close contact with somebody who is COVID-19 positive, you should get a test. And I think as the tracing initiative moves forward and really starts to ramp up, you'll see a lot more of that as well, and that the testing for the most part is going to try to be tied in some way to both identifying where we have people who are of concern with respect to COVID-19, but also trying to make sure that we use it as a mechanism to help people who have been close to folks who have tested positive to be able to be tested to determine if they test positive as well. So that then we can create the isolation and the support program for them. Yeah.
Brett Anderson, Market Watch. I got a question for you about nursing home long-term care deaths. We've had in the Commonwealth roughly the same number of deaths, confirmed deaths in long-term care facilities as New York, even though our total number of deaths is vastly below theirs. Is there a reason why we're seeing or confirming relatively a lot more deaths in long-term care facilities and nursing homes than New York or some other states?
Well, there's a lot of issues going on with respect to nursing homes generally, and I hesitate again to draw too many conclusions at this point in time. My guess is this is a topic that will get a lot of appropriate analysis after the fact. I know a fair number of people who operate in that industry, and some of the folks who've suffered some of the most dismaying, disturbing, and destructive outbreaks are terrific operators and folks who literally have never had a demerit or an issue at any point in time with respect to the work they do. I mean, Belmont Manor in Massachusetts is a good example of that. That's a 5-star nursing home. And even in the assisted living space, some of the folks who've battled their way through some of the worst examples of COVID-19 penetration represent organizations that prior to that were considered by most to be among the very best players in their space. So I guess I would start by saying I think this is one that's going to require some pretty heavy-duty analytics to figure out exactly, A, what went wrong, B, what needs to be done on a go-forward basis to make sure it doesn't happen again, and then C, to respect the fact that some of the folks who ended up in the worst spot on this, you know, were considered by their peers and by families and by everybody else as pretty high flyers and very positive players. I mean, do you want to speak to this one at all?
I'm just curious why the numbers are so much higher than, say, New York.
I can't speak to that because I don't know much about New York. I would need to know more about New York to answer that question.
Right. I mean, I think the question we need to answer is what is the per capita number of nursing home beds in New York compared to Massachusetts, for example. Massachusetts is one of the greatest number of nursing home beds in comparison to other states. So I don't actually know the answer of what New York's per capita utilization is of nursing homes in comparison to rest homes, assisted living, elder housing, and the like. There's no question we have a high degree of spread in our nursing home facilities. Many of our nursing homes are old nursing homes that were wavered in terms of having the new regulations on nursing homes. When I say new, it's like early 2000s, are that everyone has single rooms. Our nursing home industry is older in Massachusetts, the physical plants, and so you were wavered in if you had 2-3 people per room, which clearly, as we know, the more social distancing you have, the better. We are creating COVID positive, COVID negative wings within nursing homes. We have created COVID positive nursing home facilities altogether. Obviously, we're looking at infection control across all of our nursing facilities, what the staffing issues are, and working with both a management, what I've referred to as a management crisis team under Paul Valentine, create a long-term care portal to try to match staff with nursing homes, and have identified sort of what we think of as the hotspot nursing homes, where we need to really intervene in more than just sort of oversight and the like.
Secretary, could you speak to the self-swab program and the issues there, and what it would take for, best practices to be implemented so that can somehow be up and running again?
So when I think of self-swab, I think of us self-swabbing ourselves and sending it in, and that's just been FDA approved, and that's not out and about. So what this was we were sending test kits to nursing homes who had nursing staff available, or said they had nursing staff available to actually engage in the testing. I don't know if anybody in this room has been tested for COVID-19. It's a very long swab, and it's clear that it's more than just swabbing. I don't want to be particularly graphic on TV, but it's more than just like doing a quick Q-tip swab. It actually does require some level of skill. The National Guard, obviously, when they do it, we have quality control over the National Guard. When you send it to X number of hundreds of nursing homes, we didn't have the same level of quality control. So we literally just paused it, and we've expanded the National Guard to go out to the nursing homes. I'm hoping to, rekindle it because it's an effective way of getting out to homes and not having elders having to go somewhere else. But what we've done instead is we've expanded the National Guard to engage in the program.
I guess are you making any efforts to ramp up plasma therapy at all? Are there any efforts in the state? We're hearing about some success there.
So that one is not on my screen at this very moment. I'm sort of engaged in the pandemic, expanding testing, tracing, and ensuring that our facilities, both hospitals and nursing homes, have the supports that they need.
Plasma piece, I do know a couple of the hospitals have pursued that therapy, and I know they're talking to each other about it. And obviously, we're talking to them about a lot of things. If they think there's a role for us there, we'd obviously pursue it. But again, that's something the healthcare community here is pretty familiar with, and I do know some of them have incorporated it into their therapies.
Governor, could I ask you about what many consider an essential service, and that is a haircut? In this state, you can get a six-pack of beer, you can't get a haircut. There is a petition online, 7,000 people have signed it, to allow a real soft opening, one person at a barbershop at a time, everybody wearing protective gear. Have you looked into that? Have you thought about maybe loosening that up? Because we did not have the foresight that you did to shave our heads.
Jonathan, you could have been with me to help raise money for cancer research.
Maybe next year.
Unlike you, who is always expecting to be on TV every day, that was not what I was expecting was going to happen to me. I would say this. One of the questions we got asked yesterday was May 4th, right? Essential, non-essential. And we answered it by saying that we think the issue going forward is going to be less about the date and less about essential and non-essential, and more about what we would describe as the rules of the road for reopening. And I think those rules will be relatively uniform and comprehensive at a certain level, and then they're going to be defined a little more narrowly depending upon what kind of space or industry you're talking about. And certainly, close contact operations like that one would be one of the ones that would have to go through some sort of review to figure out if, in fact, you can create the kind of safety for people that would be required for both the person delivering the haircut and the person getting it. But I think the way people ought to start thinking about this is a little less about essential and non-essential, and a little more about, what are the criteria that would make it possible for any business to open up. What's the context, right? The prerequisite. We've talked about a variety of different mechanisms that states have come up with and that the federal government has proposed with respect to how you get to the point where you believe you're on the other side of the curve. We need to be on the other side of the curve before we do any of this stuff. And then the question becomes, what are going to be the rules? How are they going to work? And we started talking to a lot of folks in the business community about this. The Lieutenant Governor's had conversations. I have. Secretary Sutters has. Secretary Keneally has. And once again, this is a good example of where, because we have a lot of global operations here, companies that have been doing business in other parts of the world that are in a different place than Massachusetts is, have started talking about the ways they've gone about thinking about how they could do their work in some other place and how that might translate here. But I don't think the go forward is going to be an essential versus non-essential. It's going to be, these are the kinds of things people need to do to actually be able to start thinking about opening up. And maybe some people can do them and some people can't. But that's the way I think we're thinking about this, and I would urge others to think about it as well. Because it's not.
Would you look at that one, allowing one person in to the salon?
Well, I talked to first of all, we're not going to do that until we get over the hump on the surge, period, okay? No one anywhere in the world, much less in the United States, has suggested that it's a good idea to get into the business of giving up on distancing and the stay-at-home advisories and all the rest until you get to the other side of the surge. So that's point number one. Point number two is there will be guidance, and in some cases probably pretty forceful guidance around what the rules should look like. And then within that, people are going to have to figure out if they can comply with it.
Governor, what happened? You're allowing essential construction projects to go forward, including the wind compressor station. Why does that fall under it? And we're seeing photographs of workers down there not practicing social distancing, and also a lot of out-of-state workers coming. You could talk about that?
We've said many times that we have a set of standards and rules with respect to distancing around construction, and those standards and rules are pretty clear. And that if locals have issues with those rules, they have the opportunity to either raise it with us or the opportunity to shut it down. And In a number of places around Massachusetts, we have had local officials argue, based on their inspections, that certain projects aren't abiding by the rules that are associated with our safety standards or theirs with respect to construction, and they have every opportunity to shut those down if they wish to.
Governor, the House passed a bill last night that would require more reporting about nursing homes, daily reporting. Seems to be information you guys have already gotten. Seems like the sort of thing you and the speaker would just talk about amongst yourselves. Have you talked about it? Why is a bill having to move through the legislature to address that?
The answer is I don't know what the motivation is there. We talked to the Speaker and the Senate President and the two Ways and Means chairs and the minority leaders twice a week, usually on Monday and Thursday, about all kinds of things. And I certainly think that, as I've said several times, that there will likely be some changes in a bunch of things about the way the federal government operates, the way the private sector operates, the way states operate coming out of all this. And one of the things that will probably be a pretty significant issue coming out of this is data, and data collection and data dissemination generally. And I haven't said it here, but I said it in other forums that seminal events like this create conversations and dialogues that can have wide-ranging consequences, especially in the debate between confidentiality, privacy, and transparency. I don't know how many of you are old enough to remember when we didn't have digital medical records, okay? So back in the day, everybody's medical record was in a big file somewhere in a big medical record room, and it was pretty hard for anybody to access somebody else's medical record. Then we decided, for good reasons, that we should start to digitize all the medical record information to make it shareable between providers and to make it easier for people to aggregate data, to do de-identified studies on what treatments worked and what didn't. And then some of that medical record information got into the public domain, and the response to that was, no, stop it. We got 3 different versions of HIPAA, and the basic message that came out of that was there is nothing more confidential, more private, more nobody's business than personal health care information. And it was double, triple for any information associated with behavioral health or mental health issues. This whole thing also came up during the AIDS crisis around who had HIV and all the rest. And those standards with respect to privacy and confidentiality have been baked into everything everybody thinks about healthcare data for a really long time. Okay? Now here we are in the midst of a horrible, awful pandemic where the collision between confidentiality and privacy with respect to medical information is banging into a demand for a change in the way people think about that with respect to making healthcare information publicly available. Okay? And I think one of the things that's going to come out of this is a big change with respect to how we think about public reporting on a lot of things that are associated with healthcare data. I mean, we publish, I don't know if do we publish death data, just death data generally as it comes to, when it comes to nursing homes on an annualized basis?
I can respond to that as in the command center.
No, I mean,
I know.
The point I'm trying to make here is
It's like one long day, so I know since I've been
1,100
here.
people plus or minus, I think that's the number,
Yes, a month
die just about every month
in nursing
in
homes.
nursing homes. Okay,
In Massachusetts.
and that's been
1,100. So
I think is the number?
it's between 1,000 up to 1,700 a month die every month in nursing homes. This is pre-pandemic data.
Which no one ever
Massachusetts.
asked for or was interested in.
Right. So
That's nationwide.
no, that's Massachusetts. So I've been collecting that data because I think sometimes reporting is that there's never been a death in a nursing home based on some of the reports I've been reading, or at least some of how people would suggest that we're starting at 0 deaths in nursing homes. And it's between 1,000 and 1,700 a month. And I've looked at the data back to 2015.
So my point is that there were just the norms with respect to how we think about data and transparency because of what we're dealing with in this pandemic are going to change. And that's probably a longer answer than you were looking for, but the question you asked is why would this suddenly be something that the legislature would be proposing legislation on? And I would just say because times like this, people start thinking very differently about stuff that historically they haven't really thought was sort of a top level, needs to be publicly reported type issue.
Another grocery worker in the state in Belmont has died from complications of coronavirus. Are you considering any more stronger guidelines for grocery stores or mandating mask wearing for everyone inside? Anything?
Well, our recommendations with respect to masks and face coverings for people who can't socially distance are basically you should. And we've backed up and supported every community that's moved more aggressively to make it sort of the equivalent of an enforceable order. I think our view is it's much easier and more appropriate for locals to enforce those rules than it is for us because they're there. And that goes as well for the occupancy requirements. I mean, we put the occupancy requirement in place statewide, but locals have much more visibility into what's actually going on and the ability to do something about it.
Would you consider no customers inside, like curbside pickup only or delivery only for the grocery stores?
I haven't had people ask for that. And I do think the one concern I would have about that is the pileup it would create in the parking lots, which may defeat some of the issues associated with distancing in the first place. But let's face it, anytime anybody who's operating in one of these essential roles, whether they're a firefighter or a police officer or a healthcare worker, a grocery store worker, or a utility worker. I mean, there are a lot of people, and we've all said this before, who are who are putting themselves and their families, in many cases, in harm's way every single day, and we're doing the best we can to make sure that we create frameworks that provide them with as much protection as we possibly can. But every single time somebody's lost, there's a family that loses somebody who, I mean, when I first got asked about the gentleman from at that point it was just a person. Nobody knew anything about him. The gentleman who died of COVID-19 who worked at the Whole Foods in Swampscott. I mean, several people finally identified him and wrote stories about him, and he was just an amazing man with a beautiful family, and his loss for not just his family, but for the community that he was part of and that he had created in his own life here in this country was profound. And that's behind all of these numbers that we talk about every day, and it's part of what makes this virus so insidious and so difficult, and why I get so passionate when people start talking to me about why we can't do this, that, or the other thing now. I mean, we're trying to do the best we can to try to keep people safe. And
Governor Sununu has put a task force together to reopen businesses in New Hampshire. Does that present a threat or a problem for Massachusetts if a neighboring state is ahead of us reopening? Could people be traveling to New Hampshire to get a haircut when our salons are still closed? Does that really cause problems for Massachusetts?
so I guess what I would say is that I was on a call yesterday with Governors Mills, Raimondo, Scott, Lamont, and myself. And we were talking about a lot of these issues. And this is part of why coordinating the activities around this stuff matters. Those 6 New England states are all in different places with respect to the surge, okay? Vermont's over the hump on the surge. New Hampshire thinks they're over the hump. They're looking at a few more days worth of data. Rhode Island thinks the surge is coming. Connecticut thinks they're sort of in it the way we are. And I think one of the reasons we want to be sort of regional in our dialogue and our discussions around this stuff is so that people don't surprise us with the decisions that they make. But But if people really are going to make decisions about how they think about reopening elements of their economy, and they're going to do it based on the same metrics that the rest of us are working on, which have to do with testing and hospitalizations and some other things, if people are in different places, then you would expect them to start to think differently about what their next move looks like. I just want to make sure we know what their next move is and that they know what we're up to, so that people don't end up surprising each other and creating what I talked about when we decided to join that larger Northeastern coalition, which is a decision that somebody makes that creates tremendous difficulty for somebody else. I think and I'm sure that whatever Governor Sununu decides to do in New Hampshire is going to be something that we're going to be informed about and know about, and be able to do whatever we need to do to make sure that we keep people as safe as we can in Massachusetts.
And would that be travel restrictions for Massachusetts?
I don't want to speculate on that at this point in time. We're going to put together a reopening group of our own, and they may end up, who knows, having conversations with the team that Governor Sununu or Governor Scott or Governor Raimondo or Governor Lamont put together.
Governor, what were July 4th celebrations?
I do want to give some other people, Sharman, a chance.
Governor, tomorrow a group of protesters plan to host.
Say again?
Tomorrow a group of protesters plan to liberate Massachusetts rally in front of your house in Swampscott, urging you to reopen the economy. I'm wondering what your response is to people who might attend the rally.
Well, first of all, we spend a lot of time looking at mobility data, okay? And if you look at the mobility data for Massachusetts, it's as good as any other states in the country, generally speaking, with respect to the drop in mobility overall. And if you look at the between town stuff, the drop is even bigger. And most of the mobility that shows up is within communities, and it's fairly short. You know, it's the kind of stuff you might do if you went for a walk. And we've done that under an advisory, okay? And a series of limits on gatherings and a whole bunch of other things. And I think the people of Massachusetts have been overwhelmingly committed and purposeful in responding to the virus and to recognizing and understanding the importance of distancing and the role that we all play, not just keeping ourselves safe and healthy, but keeping others safe and healthy as well. The town of Swampscott actually has a more aggressive set of standards in place than we do. And as I said earlier to the question about grocery stores, part of the reason we wanted to create a statewide framework was to give local communities, if they felt they needed to go beyond that, the ability to do so. And I think that's the right strategy and the right policy. And I'll finish with what I said yesterday about this. There's a very significant portion of the community that gets infected with this virus that never knows they have it. Very significant. No one knows how big it is. But people say they think it's somewhere between 20 and 40%. And that number was 5 to 10% about a month ago. Then it went to 10 to 20%, and now people are talking about 20 to 40%. And part of the reason people are saying that is because as people do some of these antibody tests, which admittedly, depending upon who's doing them, have some issues, okay? I'll be really glad when the FDA finally sort of takes the funnel on that one and creates what it considers to be, you know, kind of the gold standards around antibody testing. But even on some of the more traditional tests, we tested a nursing home, 98 people, 51% positive, nobody symptomatic. One of the Navy ships where they had some issues, they tested everybody on the ship, and more than half of the people they tested had no symptoms. I think it's really important for people to recognize and understand here that one of the major reasons why distancing and why staying at home and why dealing with the consequences of all this is so important is because this is not like the flu. If you get the flu, you know it and everybody else knows it. But when it comes to this particular virus, there are a number of people who get it who don't know it. And one of the reasons we made the decision to issue the guidance and the advisory around wearing a mask or a face covering was because the data became pretty clear that that face covering is not just about protecting you from other people, it's about protecting other people from you. Because you may be somebody who has this virus and doesn't know it. And one of the only ways you can protect others, if you're going to be in close quarters, if you're going to be anywhere, is to have a face covering or a mask and to deal with all the issues that we've talked about a million times around here with respect to hygiene. This is not like any other virus, and I really hope people recognize and understand why it's so important that people act on these initiatives that we've put in place, why we're grateful that the vast majority of the people in Massachusetts have, and to appreciate that this isn't being done to punish anybody, okay? It's being done to try to keep people safe, and it's being done based on data and information on an unprecedented virus as we gather it and as it comes together.
So how will the antibody testing then, is that a big piece in your plan to get us back on track once we get over the hump? Because I know testing has been a little bit dicey, but hopefully we'll come up with a good one.
I mean, I think the antibody testing is part of it for a couple of reasons. One is it can answer sort of the one question a lot of people have, which is how big is the percentage of the population that actually has it? And it's a relatively quick test. It's a pinprick. But like I said, there are a whole bunch of tests being given that were never FDA approved, okay? And there are other tests that are wobbly relative to what a lot of the people who know a lot about testing say. I do believe the antibody thing will get figured out. But I also think we're going to need to do a lot more of the more traditional testing as well, and I expect that we will. I mean, we're doing basically somewhere between 5,000 and 8,000 tests a day at this point. We were doing, way less than half of that 3 weeks ago, and we were doing less than half of that 2 weeks before that. I think the testing thing is going to continue to amp up. I think it's going to be an important element for many businesses that have a lot of employees. I think it could be a big issue for how we think about sort of general medicine on a go-forward basis. But I do think the antibody piece, once it gets sort of focused on the ones people believe generate the smallest amount of false positives and false negatives possible, I think that'll be an important test for surveillance work.
Do you see the July 4th celebrations happening? It's very close to the June 29th date that you set. Do you see that happening on the Esplanade?
Well, the June 29th date is just the last day of school. I mean, that we didn't pick that per se. That is the date of the last day of school for most folks in Massachusetts. And we've tried, for the most part, not to make decisions based on sort of hypothetical down the road, but have tried to make decisions based on what we understand to be the facts as we know them. And I think that's going to be one of the elements that's going to land in the, back to Jonathan's question, that's going to land in the dialogue and discussion about reopening. What does that look like? What's permitted? What's not? What are the rules of the game and all the rest? Thanks.
Concerts canceled, though? I mean, it seems like there are a lot of concerts being canceled early.
I think people are canceling that stuff because they believe there won't be an answer to some of the most fundamental questions about gatherings in that period of time.
You're not ready to call that for the July 4th celebration?
We would never do that without talking to the city first. I mean, they have a huge role to play in that.
Thank you.